Do you pay coinsurance for Medicare preventive care? Have you ever wondered if you need to pay coinsurance for Medicare preventive care? Let's break it down together. For most preventive services covered under Medicare Part B, you typically do not pay coinsurance or a deductible. This is true if you see a provider who accepts Medicare assignment. When that happens, Medicare covers 100% of the cost for preventive services like screenings, vaccinations, and wellness visits. This applies to both original Medicare and Medicare Advantage plans. However, keep in mind that Medicare Advantage plans may have specific network rules that could affect your coverage. So, it's good to check your plan details. Now, here's where it gets a bit more complex. If during a preventive visit, your provider discovers a new or existing health issue and performs diagnostic tests or treatments beyond the preventive service, you might be responsible for coinsurance or co-payments for those additional services. The preventive service itself remains covered at no cost, but any related diagnostic or treatment services are billed separately. Another point to consider is where the preventive service is provided. If it takes place in a hospital outpatient setting or an ambulatory surgical center, you may have to pay a facility fee or coinsurance. For example, a 15% coinsurance might apply for the facility fee, but the Part B deductible does not apply in this case. Medicare also covers one Welcome to Medicare preventive visit during the first 12 months of your Part B enrollment. After that, you can have one annual wellness visit each year. These visits are designed to create or update a personalized prevention plan. You pay nothing for these visits if your provider accepts assignment. However, if additional services are provided during these visits, charges may apply. It's important to note that routine physical exams are not covered as preventive services under Medicare. If you decide to have an annual physical exam, you will likely have to pay coinsurance or co-payments for that service. To avoid any unexpected costs, it's a good idea to confirm with your healthcare provider before your appointment that the visit is a Medicare-covered preventive service. Also, clarify whether any additional tests or treatments might incur charges. Lastly, ensure your provider accepts Medicare assignment to benefit from full coverage without coinsurance. In summary, while Medicare preventive care services usually do not requiring coinsurance payments, there may be charges if additional diagnostic or treatment services are provided during the same visit, or if the service is performed in certain facility settings.